Hello again, everybody. I hope you had a great day, healthy and full of joy. Before I start our subject of the day, I want to thank everybody start to following my YouTube program. Appreciate it for many of you subscribe and many of you send me an email and you've gone through the website Dr.Sokhandan.com. Some of you had a question and I answered via email. You guys send it to me. Whoever enjoying the program, who would like to follow about all the health issue and some of the question you have, please subscribe and give the thumbs up and ring the bell on your side of your YouTube on the bottom part. And also, if you go to website, you can ask all your question, like many of you ask me via email, and I had many question from different part of the world. That was a great news was for me to look at. The people are so connected this day via internet, and not anymore you can seek help for any issue you have from your computer, from your car, from your kitchen, stock market, and now is a health. And you can find any doctor, any part of the world to get connected and get your answer if some of the issue you're experiencing and you don't have that chance to talk to your doctor. Some of you ask a question about what is normal blood sugar in the morning. That's the broad question. I can give a very simple answer, but you can follow up with your doctor and ask a specific to see what they can see on your blood work. Usually, blood work should be in the morning between 89 to 95. That's what I would like to see. And I know it's below 100 is okay, but 89 to 95 is a good number. And tell me that patient, the blood work with the 89 or 85 to 95, the amount of the sugar stay in the system to cell use until the next meal. The body is not striving and not seeking extra work from the system, and enough sugar in the blood circulation to feed the brain, to make sure brain is happy until you wake up and you get to your daily meal, which is going to be your breakfast first. Usually blood work, when we look at in the morning for the blood sugar, they call fasting. I would like to see between 12 to 14 hours. Why 12 to 14 hours? Because the time of you eat the food, the transient time, the time get digested, the time get absorbed, and the excess move to the colon and get dumped out in the morning. The system do not have an excess sugar or working throughout the night and secrete extra insulin to move that sugar to the cell. And that's the good number. Some of you can probably, or perhaps you're a night owl and you work late, you get home. By the time you get home, you're trying to wind down and start to eat a meal. And if you did not eat anything through that process before your dinner, and if your dinner is right around 8, 9, sometimes 10 o'clock, some of you just want to go to a restaurant after 10 o'clock, especially in Europe, that is customary. Not right now in the COVID, everything is shut down, is not as much of a people going out for eating on the restaurant and entertain themselves. For that reason, if you eat that late of the night, you have a 4 to 5 hours of a transient time. It means the food has to move from a stomach has to secrete is a gastric juice, then orders go to the pancreas, to the gallbladder to secrete the enzyme to digest your protein, fat, carbohydrate. Then from there is move on to the end. Then by the time you going to bed, maybe 2 hours after your meal, maybe 3 hours after meal, if you are around 1 or 2 o'clock in the morning, you go to bed, or if you eat 8 or 9 and you go to bed at 11, your system not going to be shut down at least for 4 to 6 hours. Then body still is working. Then you get up in the morning and you have to go to the blood work, and should be a fasting blood work. And you go at 7 o'clock, do your blood work. Then you see your blood sugar spike to 110, 112, 116, sometimes 130. Then the doctor look at your blood work and said, well, let's just go ahead and do other blood work to check your sugar of your system. Then they send you for next day to do the again fasting, then 2 hours after meal. Because they want to see whenever you eat food, the blood sugar before and after, what the fluctuation is. And also they're going to check the insulin to see how much the insulin is spiked. Based on that, and they do other tests to make sure you are not diabetic. We will talk about all this subject in many other video, which is going to be many days to come. Can be every day, can be tomorrow, can be a Friday. Do not know. I work-based subject, but you know what I feel. You guys ask a question because this program belongs to you guys. If you ask me a question, I try to put the subject toward that question. Then from there, if you are diabetic, then the doctor will gonna prescribe you a medication to balance or maintain your blood sugar on the normal level. Unfortunately, when you start the medication, you will gonna have lots of side effects and lots of other stress from medication to the system. My belief system is we have to exercise every other avenue before we go to prescription of a drug. But to answer you guys' question, whoever asked me, was the three of you guys asked a question. Normal blood sugar in the morning between 85 to 95. Above that, it means system is stressed out. Then also kidney get involved because the excess sugar in the system in your blood circulation will damage every cell of your body. 2, 3 other questions I will postpone to the next segment, which is can be tomorrow. Answer you guys. Again, if you guys like my show in YouTube, please subscribe, and you can go also to Dr.Sokhandan.com. Over there you can go ahead and write email to me, ask your question. Also I got on my website I have lots of a subject which you guys can explore and read about the many disease which is I posted in my website. The other question which was important for me to talk about today, it was about hypoglycemia. Lots of, I think 3 or 4 people asked, they heard about the hypoglycemia, but they do not know what the hypoglycemia is. And they asked me if I can talk in my show. Hypoglycemia, it means abnormal low blood sugar in the system. And of course, I have to let you know, hypoglycemia, it is not a disease. It is a symptom of disease. And it shows people with the hypoglycemia, they end up to have high blood sugar and be diabetic at the end. Whenever we're looking to hypoglycemia, we have to see what type we have. We have two types of a hypoglycemia. One is overproduction of insulin from pancreas. The system will produce excess of insulin because of it. Pancreas is stressed out. Maybe inflammation, pancreatitis, and right now it shows the number of inflammation of a pancreas increasing year by year. And if any of you know Steve Jobs, the owner of Apple or the founder of Apple, died of a cancer of a pancreas. For that reason, pancreas is one of the important components of our digestion system, which is needed to make sure our system works on optimum. When your pancreas gets stressed out, it will affect the system because pancreas secrete around 10-11 hormone plus the insulin. Insulin is secreted with a little group of a cell in the pancreas they call it isola-Langerhans. They just produce only insulin. When pancreas get exhausted or overworked, produce too much insulin, then the sugar it get dropped because insulin will take the sugar and move to every cell. When it's excess insulin in the blood circulation, it creates some symptom, which is I explained symptom. The second component, hypoglycemia, it is caused by diet, by your daily habit, which is majority of people with a pancreatitis, inflammation of the pancreas, or high production of insulin from their pancreas based on this diet, which is they call a diet issue. The people eating more food without fiber and is more sugary and more carbohydrate. Alcohol can be one of the components which is detriment to the liver and pancreas because it's a pure sugar. Body do not have to do anything to digest it because it's already been digested. System take it and use it right away. Now, whenever we look at the hypoglycemia, got some sign and symptom. The sign and symptom in each person is different and has a different symptom, different time of the day. Whenever we're looking at the hypoglycemia, say in the morning, when you wake up in the morning and you don't get to your breakfast or you don't get fast to your food, some of the symptom, not every person experience all of the symptom, but some of you experience some of the symptom. Those symptoms can be fatigue, weakness. It means you get up in the morning, it's hard for you to stand up. You feel you are not balanced. You feel excess hunger. Even you, sometimes you eat at 12 or 1 o'clock in the morning. You wake up in the morning at 6, 7, you are so hungry and you want to go to the food right away. The other symptom can be palpitation, your heart race, and sometimes you can hear your sound of your heart in your ear. Headache can be occipital, can be frontal, or can be a temporal. Any of those headache can come with a hypoglycemia. Agitation, some of you get very agitated until you get to your food, then you get calm. Cold sweat be another symptom. Those people with the hypoglycemia experiencing this. And also constipation. Whenever you get up in the morning, you have to go empty your colon. It's difficult to defecate. Those symptoms for the people experiencing in the morning. Sometimes you don't experience all of them. You can experience between 1 or 2. That should be pay attention to make sure, talk to your doctor and bring to their attention. The other symptom which is people experiencing in between the meal. Between the meal is a foggy mind, depression, anger, crying spells. This means with any emotional change, anybody say something sad or anybody say something to you, you start crying. And also profuse perspiration. This means you sweating so much. That is a hypoglycemia symptom. That profuse perspiration sometimes can be a thyroid issue. Just remember, some of those symptoms which is I explaining right now, it can be other disease process in the system. Just like constipation is not a disease. It is a symptom of a disease. Headache is not a disease. It's a symptom of a disease. For that reason, we have to pay attention when you guys experiencing those symptoms, early morning or midday. And sometimes in a early morning can be just a 1 or 2, 3 of those symptoms: headache, fatigue, shakiness, and a little bit of agitation. It's not all of them can be at the same time. For diagnose, you guys need to talk to your doctor. Make sure that they check your comprehensive metabolic panel. Make sure they check completely blood sugar panel. Can be from your fasting blood sugar, insulin resistant, can be your hemoglobin A1C, can be EHG. Those your doctor know. If you ask them, you want to check for complete blood work for your blood sugar, maybe your hypoglycemia, they will check. And also, sometimes your doctor can order your cortisol. Whenever we're looking at the cortisol secrete from adrenal, and we have to check adrenal insufficiency. Those cortisol, because it's an anti-inflammatory, is great for our system, but at the same time, it has a function to break down the glycogen, turn to glucose. We need to check, make sure we don't have no stress in our adrenal. I hope you enjoy this session of my show in the YouTube. If you guys enjoyed it, please subscribe and ring the bell, give the thumbs up, and go to my website, drsokhandan.com, and send me an email with any of your questions you have, and send it through email to me. I will answer you most definitely. Have a great day. See you next time.